Okay, good afternoon. Just stay for 2 minutes, listen from there and then sit. This class was supposed to be taken by Dr. Deepti. She is on vacation. Dr. Pankaj was supposed to take this class, but she is seriously sick. So I had to come in a very short interval of time. The entire slide sets are made by Dr. Deepti only. I have made just few suggestions. Usually I take in some different manner. I include certain other things. I will try to incorporate some of those things when we have the session. So this is something about human behavior. You might be wondering why as a doctor you need to learn about human behavior. Any idea? Why as a doctor you need to learn about human behavior? That is for humanists, sociologists, especially psychologists. Okay, you can try. Why as a doctor do we need to learn about human behavior? You are not going to treat behaviors because you are not going to be psychologists. So why do we need to learn about human behaviors or any theory, any practical skills, philosophies related to human behavior? Medical science is science, human behavior is arts. Why human behavior? Any idea? Anyone? Yeah, any idea, any guess how much of human health is influenced by human behavior?
Majority of it because what we eat, how we exercise, everything leads to changes in our health.
Okay, sit down. A very popular estimate called as global burden of disease, U2. So a very popular estimate called as global burden of disease mentions that about 70% of the disease burden, you understand disease burden, I guess all of you, about 70% of the disease burden because of non-communicable disease, which is going to be, is already the disease of current, present and future, is because of behaviors. That is one, the burden. And as a doctor you might already have come across situations when the patients already, even though told that you should do a certain thing like take a medicine, consume a medicine or get a procedure done or get some behavior change, some harmful behavior change, they don't do it. We Indian doctors have been told that we are gods, so whatever we say should be done, but that doesn't happen. So what to do when these kind of things will come? You need to learn human behavior because of especially these two things. There will be some more scenarios in community medicine or public health. You have to design interventions, you have to test those interventions at the population level. So if we have to design and test some interventions at population levels, here the issue of behavior will be more and it will be more complex. As a clinical doctor, it's mostly one-to-one interaction, patient and a doctor, at most a family member. But the moment it includes people in the same community, in a mohalla or in a village, in a district, in a state, it becomes more and more complex. So that is the reason we need to understand human behavior. And you might also agree that even during one-to-one interactions, things which has happened at national level or state level, even global level, influence what the patient or the doctor is going to do. It's both ways, mostly from the patient's perspective. So we are trying to make you understand how human behaviors can be predicted by having this session, right? So risk and then risk perception and risk communication, right? So I hope by the end of this you should be able to attain these things. You should be able to explain the need, you should be able to describe the importance of risk perception, you should be able to understand what is framing and use this knowledge when you have to design in the subsequent classes, design health education sessions or interventions, and ultimately as a doctor you should be able to communicate the risk of many things such as investigation or a procedure or a disease to an individual or family, at least at this level you should be able to do that. Okay, so for that we need to understand how and why health decisions are made by individuals. So if we talk about health decisions, they need to be sound, they need to be appropriate adequate. So for people to have those kind of decisions, we need to understand certain things. Say for example, choices. The choices of course are personal, may be influenced by people around us, sometimes people who are very distant. So if choices are personal, some examples such as some people may choose to wear a bicycle helmet or a seat belt. People may choose to read and follow fire escape routes written on first floor, second floor, on most of the lifts. So anybody who has read all the fire escape routes, अभी इधर आग लग जाए तो कहाँ से निकलेंगे? यहाँ से कूद जाओगे? कहाँ से? उससे? यहाँ से? किधर से है रास्ता? कैसे बाहर जाओगे? ये तो पूछ रहा हूँ. इस गेट से. फिर? अरे किधर? You will use the stairs and then where will you assemble? हाँ? अरे outside तो पूरा भोपाल है. Outside the building तो बहुत कुछ है. There is the front side of this Kautilya Bhavan. There is the medical college front side. Which part of this place? 125 people have to. I guess many of you are not here. Where will you go? So I was just trying to prove right now that most of you have not read it. There is a fire escape route. You choose not to read it. I am not blaming you. We have choices. We feel at risk, then we make those choices. That is a very simple example. There can be similar other examples like health related examples of buying and using condoms. Choices can be made as a citizen. Those choices were made at a personal level. Then choices would be had as a citizen. Say for example, citizens of Bhopal may choose. I hope all of you are aware of a place called as Adampur. No idea? 6th semester mein hai na ye log. So you already had your environmental health classes. Environmental health classes. No idea? Happened last year. What happens to the solid waste which generates in your hostel, in our houses, in the hospital? Solid waste समझ में आता है ना? Domestic waste. What happens to that waste? It has to be managed most commonly by dumping, that to controlled dumping. And the place where it is done is called as Adampur. It's about 20 kilometers from Bhopal, rural area. About 4 years back it started. Before that there was a place called as Karond. Anybody has gone to People's Medical College? Anyone? You might have seen a very beautiful green colored mound there. That used to be a very pathetically organized place. तुम तो 5 मिनट खड़े रहोगे वहीं पे. आ जाओ अंदर. Yeah, you stay there for some minutes. I'll decide. Okay, so that Bhanpur used to be that. When it got shifted to Adampur, people or the citizens of that village, they chose to protest against it. The citizens of Bhopal can protest against the citizens of Adampur. Why are you not allowing the refuse or rubbish of Bhopal to get collected or dumped there? We'll compensate you, something like that. But still they will have a choice. Or people can choose to support salt iodization by various means at a larger level. There was a time when salt iodization was, that ban was, there was a ban on salt iodization and it was again revoked. So that happened for some time. Or people may choose to send or not send their children to sex education classes. So those kind of choices will be made as a citizen level, in a group level. Single choices may have large effects. Single choices may have effects which accumulate over multiple exposures. So say for example, buying a safe, big safe where we can keep things very in under lock and key, or buying a car. It's a very large decision. People can make those choices in an impulse. People can make those choices after a lot of deliberation. No problem. People may choose to take a dangerous job like going to the armed forces or becoming a doctor. Being a doctor is also a bit dangerous, right? A person can choose to become pregnant or not become pregnant. So these are single choices, but they have a very large effect. But often there would be some choices which are accumulative. For example, doing exercise. So when you may realize, when you advise people to exercise is not something which is one-off. It has to be continued, and after a lot of additions, the effect will happen. Or avoiding trans fat, it has to be done multiple times. Or wearing seat belts, it has to be done every day. Someday there will be an accident and the seat belt should be in place. So changes or choices which may have effect, but small effect, but it gets accumulated. Some choices out of them may be having an effect on health directly or indirectly. So purchasing homes that require long commutes because that is cheaper, or maybe it is nearer to your relatives, that is a choice which is not related to health usually. Or choosing friends with whom you exercise regularly. I guess in the subsequent classes you will be taught about something called as health trans-theoretical or stage of change model. There this example will come when you will be told about preparation for a change. So there choosing friends who exercise regularly will come. If somebody wants to start exercising or continue exercising, this choice will affect that the other choice. Or joining groups which is opposed to vaccination, that's a choice, but it is health related. So this kind of understanding we need to have. I hope you have been told about this figure. Health communication, तो हो गया होगा ना class. Health communication, anyone? So there you were taught about, in communication we have a source of information, then we have a transmitter, the person or the thing, the entity which transmits that information. The message comes from the source, gets transmitted. There are different types of signals. So from the transmitter it gets emitted. It's mostly used in engineering. The same thing can be applied to us also. As a doctor, we are the source of information. We have some message to give to the one person or a group of people. We will use certain modes of doing that transmission, face to face, through a video, through an audio, through an article, and there would be ways to transmit signal, emit that signal, and then the signal or the message will be received by the recipient, the beneficiary. In between there will be a lot of interferences. Radio में तो बड़ा simple है समझने में, but in real life, suppose let's take the example of that vaccination. So during COVID we saw it. We saw healthcare professionals not agreeing to the message of the government and not getting vaccinated in spite of getting the adequate scientific justification because of a lot of interferences. The interferences can be interpersonal, inside the person, in form of a belief obtained from the family or from some other sources, or maybe coming from some other what we call as blockers, people who actively pursue to block a certain message or distract or deviate a certain messages. So this interferences. So when we apply this kind of model in healthcare, we have to understand how to explain all of this. You will ask like that. You will be probably asked to draw this diagram, will be given a scenario and then explain about each of these elements. Then the receptor will understand the message and something will happen. The message will have some destiny. So let's take this example, and there is a photograph. I want to do two things. First, you look at the photograph. I want all of you, especially those who are sleeping. I am notorious to go in the back and note down for roll numbers and use in the exam. हाँ जी उठा दो उसको, सोने के लिए नहीं बुलाया यहाँ, है ना. मैंने 1 घंटे बैठ करके सारा पढ़ कर तुम्हारे लिए पढ़ाने का डिसाइड किया ना. You also need to spend time listening to it, right? Okay, so I want you to do two things. I'll ask randomly from this point onwards. So first look at the photograph with your eyes fully open, and then look at the same photograph with your eyes partially closed. You might have done it many times. ठीक है? Fully open, क्या दिखता है? An angel, nun, a nice girl, noble girl, right? Partially close करो. Partially close करो और फिर देखो उसको. क्या दिखता है? This is called as perception. This is a very dramatic example of perception, you getting misperception. The same thing happens in our life. If that is related to health, that kind of misperception may happen. You might get examples of a very senior doctor saying, this is what should be done because this is what I have been doing for 35 years. Sir, you might have been misrepresenting fact which you read with half opened eyes 35 years. Possible? Absolutely possible. It's not only possible, it happens very frequently. If we have some time, I'll try to explain some of the examples at last. Okay? So this is perception. So what happens to the same real risk and perceived risk? So what will happen to the real risk? There may be problem in the way the message was given. There may be the problem with the source of information. The receiver may not believe in the source of information, may have its own biases. Okay? Because maybe belonging to some other religious group, maybe belonging to some other sex or gender, some other state, some other country, lots of things based on the characteristic of the source of information. There may be problem with the transmitter or the signal, especially important the interferences, may be problem with the receptor himself or herself, right? And then the perceived risk comes at this point of time. So this you should understand if you have to explain perceived risk and how it gets influenced by different elements of this diagram. So let's come to risk perception. We all know that risk is simply the probability of any event. So what is the risk? That a person will die. We know what is the longevity or life expectation, and at different points of time or at a certain age of a person you can get the life expectancy, and if we add those mathematically we get the life or the risk of death at a particular age, right. So that is a very complex example of risk. The simple example of risk in a hospital would be what is the risk of a patient dying if admitted with, say for example, stroke. We know that we might need to study 100 or 200 or 500 patients, right, and we see how many of them survived, how many of them died. Suppose 20 of them died. So what is the risk of death in stroke? 20 by 500. You can represent this in many form. You can represent in percentage. So 20 by 500 into 100, how much? Right. So you can do it in multiple ways. You can do it in form of a fraction or in form of a decimal. There are other complicated examples which you might have come across when you were taught about morbidity indicators or mortality indicators. So risk is simply the probability of an event happening, and perceived risk is simply the particular from a particular threat is different that happens inside a person. It may be true for a community also. We may be asked to do the same thing for entire community based on, if you have been taught about cohort study, there is a concept of background risk. So background risk means everybody is exposed to a certain thing. Say for example, all of you are consuming from the same kitchen. So there is a common background risk of acute gastroenteritis among all of you, right? And then on addition to that, there would be some extra risk. Somebody eating more outside, somebody having some drugs for ARI or something, antibiotics. Got it? Got the idea? So that kind of risk. But the perceived risk will be different among different types of people, right? The perceived risk of the entire community may be similar up to a certain level. Entire community may be having a common belief, that is the perceived risk of being exposed or not exposed to a certain threat. So risk perceptions, they get derived from risk appraisal. People appraise or people assess the risk and then make an opinion about it. And often these opinions become something called as belief. So risk perception becomes a part of belief, right? Okay, so two gentlemen, they defined it. So it's one's belief about likelihood of personal harm, whether a particular risk factor or absence of a risk factor will harm me or not, right? This is a very important construct. It's often very central construct. Construct means central theme or central domain in many theories of human behaviors. And some of this theory you are supposed to use in your day-to-day clinical practice or public health practice. So theories like health belief model are very, very popular theory. I guess this will be taught to you. Students of AIIMS Bhopal are very known to be quite conversant with this theory. Most of our faculty members and teachers, they will teach you, they will give you examples. Then there are some other ones. So transactional model of stress and coping, it will be probably taught in psychiatry, right? Many other theories, this risk is central thing. So risk perceptions, they are related to health behavior, and higher risk perception for breast cancer, for example, may or may not be predictive of mammography screening, right? So it depends. The risk may be similar to the risk perception, the perceived risk of an individual or a group of individual may be higher for having breast cancer. If it is higher, perceived to be higher, then the individual will go for mammography screening. This is true for USA. For in our country, the same thing will be clinical breast examination. The government of India and many of the surgeons, they propose or they explain the patients to undergo first clinical breast examination and then if required mammography and other things. So, if the perceived risk is higher, then only this will happen. In some domains, the relationship is very small. Say for example, HIV. Probably a lot of Indians, it has changed dramatically in the last 2 decades. A lot of Indians are aware of HIV, what HIV is, and probably all of them know, most of them, more than 90%, they would be knowing why HIV happens. They know that HIV happens because of unsafe sexual behavior. Still, this doesn't change. So, the behavior of indulging into unsafe sex does not correlate equally with their perception of HIV risk or knowledge of HIV risk. So, this may be true, this may happen, this may not happen, even though the risk was higher. Somebody who is indulging into risk behavior may already be knowing that his risk of developing HIV is higher, but still indulging in that. So, risk perception may or may not correlate with their behavior. So, risk perception is based on many things, especially facts, what kind of facts the person already knows or does not know. It depends on feelings also, it depends on the cognitive factors related to their brain and organic systems, and motivational factors inside and around. It also, this perception, it has to be treated with trust. Whatever risk perception a person has, तुम जब patient से बात करोगे, if somebody is having a weird risk perception, we should not react. The moment you react, if you remember source of information, the source of information has got violated. This patient or this group of individuals will have a particular belief about you now. नहीं, इस डॉक्टर से तो बात नहीं करनी, हमारा मजाक उड़ाता है. Say for example, I hope all of you are aware of transgenders. The moment I've seen it happening, I guess it might have changed after now. The moment people see transgenders, many of them start smiling, clapping, laughing, even prodding. That is one of the reasons, and I've seen people commenting, why don't they work? You might have seen them begging in trains and many other places, and you might have wondered, why don't they work? Why don't they work? Related to trust. They worked, they tried to find work, or they worked, but they were harassed. So, often they were harassed. That's why they don't have the trust in the source of information. If they do not have, that's why I took the example especially of transgenders, because they are one of the risk groups for HIV. They are at higher risk of developing HIV as compared to any other other sex or genders, males or females. So, that trust becomes really important. Transparency, what kind of, how the information has been really submitted, whether the health system has or the scientific community has suppressed some information and or given all of them or not. Like say for example, a new vaccine, whether all the side effects have been given in the product material or in the government's messages. So, that is transparency. Early response, listening and planning. Okay. So, what are the determinants or what are the things which influences risk perception? First one is health literacy. First one is a lot of things related to something which is already present inside the individual, that can be very easily measured by an entity called as health literacy. So, health literacy is simply the ability of people to access, understand, appraise and use health information. So, access, whether they know where to access the health information, whether they can understand that health information, whether they can appraise. Appraise means examine and find it to be correct or incorrect or to be used for them, and ultimately use that health information. A very simple examination, you might have encountered scenarios where the patients or the caregiver would have asked you, sir G9 कहाँ है, G10 कहाँ है, हुआ ऐसा? What is that? That is called as navigation. Navigation is one of the most primitive examples of health literacy. People are so health illiterate, they are not even able to navigate themselves through the health system. So, navigation means एक्सेस पहले चाहिए नेविगेशन का, कहाँ मिलेगा एक्सेस, G9 कहाँ है, कहाँ पे लिखा हुआ मिलेगा, ओपीडी एंटर करेंगे, बड़ा सा है ना, बड़े बड़े बोर्ड है, उनको मालूम नहीं कहाँ पढ़ना चाहिए. They do not know that. Even if they know, they are not able to understand that. If it is in form of a technical jargon, तो technical jargon समझ में नहीं आएगा. Say for example, you want to tell people suffering from oral submucous fibrosis. नाम सुना है डिजीज का, oral submucous fibrosis? Yes or no? Never? Okay, so this will apply to you then. Oral submucous fibrosis happens because of repeated use of areca nut. Some of you know, some of you don't know, right? So if we use this term for telling people the ill effects of areca nut and tell them, if you do not, हिंदी में कि आप areca nut या सुपारी चबाते रहेंगे तो आपको कौन सी बीमारी हो जाएगी? ओरल सबम्यूकस फाइब्रोसिस. इसके लिए कोई अच्छा हिंदी में नाम समझ में आ रहा है? क्या बोले हिंदी में? डिफिकल्ट है या? सो दैट्स व्हाट वी कॉल अंडरस्टैंडिंग. ठीक है. एंड देन अप्रेजिंग, एग्जामिनिंग, सही है गलत है, साइंटिफिकली करेक्ट और इनकरेक्ट दैट, एंड देन यूज दैट. यूज में सम अदर फैक्टर्स विल कम, वेदर आई हैव द authority and power to do things on myself or whether my family members decide. मेरा husband decide करता है या मेरे पापा decide करते हैं, और I can decide. So all that can be captured through health literacy. There are simple tools. So newest vital sign, if somebody wants to know about this, you please approach me, I'll tell. We have done some research on this newest vital sign. It's a very simple tool. And then there are some quite scientific tools. These are more scientific tools who are complex tools. ठीक है. So these are simple methods. In Western society, Canada, Australia, Western Europe, USA, majority of the clinician, they first assess health literacy of the patient. Then only they start to talk. Some assistant, a nurse or somebody will do this first, then the doctor will start to talk with the patient. So the doctor already knows, depending on what kind of tool they have used, what is the status of health literacy of my patient. And depending on that, they already have materials to share with the patient or the family members. ठीक है. हमारे यहाँ slowly it has started, but still quite not in the acceptable domain. ठीक. Second one is under accumulation. Some health perception may become under accumulated or accumulated lower than what it should have been. So if, say for example, there is a relationship between smoking and lung cancer, we know that. If the risk is considered for an extended period, the smokers fail to see the dramatic change. Initially there won't be much risk. 2 सिगरेट पी लिया तो लंग कैंसर हो जाएगा क्या? नहीं. 20 पी लिया तो, 200 पी लिया तो, there is a tipping point. We know that from our knowledge, because after some time, if someone stops it, so the same thing goes back to normal after a certain duration of time. Often the smokers are not aware of it. So the risk perception is under accumulated. ठीक है. So similarly, you can see the risk of contracting HIV after that high risk behavior. The person already knows that this female sexual worker is positive and he is doing some behavior changes, maybe using a condom or something, but he does not know if there is a single interaction that did not happen. He went there 6 months back, got tested. After 6 months, the window period is over. The HIV test came out to be negative. What in the second time? So often the people consider it to be 50-50. Now you understood under accumulation? Okay. Then heuristics. Heuristics is simply cognitive shortcuts. You also take cognitive shortcuts, है ना? Guesswork, scientific guess, or educated guess. So educated guess or rule of thumbs we often call it. So availability heuristics, or if something is available. So plane crash and automobile deaths. So if a plane crash has happened, for some time, what will happen to the people? People of that area will stop using airplanes. Or if there was a very severe automobile death, it changes the behavior of people for the some time. Similarly, for a celebrity seeking cancer treatment, I guess some of you may be aware of famous actress Angelina Jolie. No? उस generation को हुई नहीं. So there is a very famous actress called Angelina Jolie. She got diagnosed with breast cancer and both her breasts were removed, right? After she got diagnosed, a lot of the women in USA, they got screened. A lot. There was this visible upskirt. in the graph of people getting screened. So these kind of things do happen, cognitive availability heuristics. And then representative heuristics, shortcut. If someone in the family has it, probably I have it. This will happen to you. This might have happened to you a lot. सर छाती में बहुत दर्द हो रहा है, घबराहट हो रही है. अच्छा, आप तो 22 साल के ही हो, 3 साल से हो रहा है, अब क्यों आए? वो सर एक चाचा जी का हार्ट अटैक हो गया. ओके, दिस इज representative heuristic or representative shortcut. The risk perception has suddenly increased because of the change in knowledge of the family members' risk. ठीक है. It is also related to motivational factors, so self enhancement, how people can feel vulnerable or not feel vulnerable. So people do not want to feel vulnerable, especially to the diseases which are at higher risk of death or disability. People may have perception of control and self-efficacy. It's very much related to particular other sub risk factors, such as male young persons may have false sense of self-efficacy. अरे सिगरेट मत पियो, ये मत पियो, देखो उसको हो गया कैंसर. अरे नहीं सर, मैं तो जब चाहूँगा छोड़ दूंगा. So this is a false sense of bravado, right? So that self-efficacy or self-belief is inappropriate, but still it happens. परसेप्शन ऑफ कंट्रोल, नहीं मुझे पता है कितना करना होता है, या मुझे नहीं पता कितना करना होता है, मैं तो नहीं कर पाऊंगा. बोथ वेज इट गोज, मे गो इन द नेगेटिव वे और द पॉजिटिव वे. ठीक है. देन सोशल कंपैरिजन ऑल्सो. इफ समथिंग हैज हैपेंड इन द नियर बाई सोसाइटी, इट मे और मे नॉट हैपन इन दैट इंडिविजुअल. कॉम्पिटिटिवनेस वाला फैक्टर, और इट मे बी इन द अदर वे ऑल्सो. सो इफ समथिंग हैज हैपेंड टू द अदर मेंबर्स ऑफ द सोसाइटी, द वरी मे बी इनऑर्डिनेटली हाई. यहाँ उसका हमने देखा था, उसकी तो बहुत हालत खराब होगी. Information is not complete, partial information है. Say for example, palpitations. You know palpitations? So it is found in which diseases? Atrial fibrillation may also be found in anemia. People usually do not die of anemia. Usually, people very quickly can die of atrial fibrillation. एक 70 साल की बूढ़ी अम्मा को हुआ, घबराहट होती थी अम्मा को, अम्मा की डेथ हो गई. रिलेटिव भी नहीं है, सेलिब्रिटी भी नहीं है, स्टिल द वरी हैज बिकम हाई, एंड देन दिस इंडिविजुअल मे रिपीटेडली कम टू अ हेल्थ फैसिलिटी और डिफरेंट हेल्थ फैसिलिटीज. ठीक है. वी हैव समथिंग कॉल्ड एज डॉक्टर शॉपिंग और हेल्थ केयर प्रोवाइडर स्विच बिहेवियर. दैट मे हैपन बिकॉज ऑफ सोशल कंपैरिजंस. बहुत कॉमनली होता है. So after understanding risk perception, then we come to risk communication. So risk communication, of course, is a very important part in public health practice. It is focused on the dialogue between the people who are affected or concerned, and we want to ensure evidence-informed risk communication. Evidence-informed means whatever sentences or messages we are using to tell people about a certain disease or a certain procedure, it should be backed with evidence. Any idea what is the best form of evidence? Best form of evidence. सबसे अच्छा एविडेंस क्या होता है? कहां से मिलेगा एविडेंस? बुक से? फिर सिस्टमैटिक एनालिसिस नहीं. देयर इज अ स्टडी डिजाइन कॉल्ड एज सिस्टमैटिक रिव्यूज. Not only that, it has to be used with certain more adjectives and adverbs. So systematic reviews of well conducted randomized controlled trial. This is the best form of evidence. ठीक है. And just below that would be randomized controlled trials. वहाँ से जो evidence आया है, the main result of that paper should come into textbooks, and from those textbooks or guideline should be used by you while doing risk communication. तो ये तीनों बात याद रखनी होती है. So say for example during COVID-19 pandemic also, at a public level, in a really comprehensive and an organized manner, it started with H2N2 epidemic. I guess most of you were not even born at that time. 2008-9, born already, na? Not born? Born already. मैं भूल जाता हूँ बार बार. Right, so really small kids. So it happened in 2008-9, and the WHO for the first time realized if such a scaring thing happens at the world has started to become really a smaller place because of the social media. Social media had not started at that time. I was a PG. So that time the CDC and WHO came together and developed the public health communication guidelines. So the concepts of blockers and champions that came for the first time, and how the message should be framed. Framing, I'll explain what framing is. And that was used during COVID-19 pandemic really well. So you might have seen WHO Secretary General or the President of USA, that one, which is also the current one, and there was another president who was considered more effective. So those kind of communication happened, sometimes with evidence, sometimes not backed by evidence, है ना, ivermectin देना है कि नहीं देना है type का evidence. So one president was all for ivermectin, even without evidence. The next president simply told in a simple way, simple English, that this is what CDC has found. So we as a government, we do not recommend ivermectin for use in COVID-19 prevention. ठीक है? So that depends. So there are stages in risk management. When we have to manage or assess the risk, there are stages of management. So what we have to do? We have to do one or all of this, depending on how much of skill, expertise, the cultural acceptance and the cultural integrity or not integrity, cultural complexity of a particular society is, or the government, how much transparent a particular government is. So we have to get the numbers right. So what do we mean by get the numbers right? That collection of data and evidence. How many patients are really suffering from a particular disease? How many people died of COVID or how people died of some other disease? Then tell the numbers to the people, to the scientific community, and then the people explain what do we mean by those numbers. वो percentage रहेगा. Say for example 12. What does it mean? अगर मैं बोलूँ 12, क्या मतलब है इसका? Yeah, उसको बोलो उसको. Yeah, please stand up and tell us what do we mean by 12? Yes, you. हाँ, तुम्ही. The girl with specs, please. What do we mean if I say 12? What does it mean? नहीं समझ में आया? Last 3-4 minutes you were here. बताओ. Okay, sit down. It can mean anything. Can be the value of hemoglobin. Can be the weight of a child. Can be the question number. Can be anything. So the number has to be told. What exactly that number is. What that number means. And then we have to tell people whether they have accepted similar risk or not. So there would be variations. Everybody will not be having the same numbers. So 11 hemoglobin may not be anemia for everyone. Correct? समझ में आ रहा है ना? Then whether if a number or if a information has been given, if it is good for them or not. Then of course after they have agreed and changed their perception or had a perception, treat them nicely and make them partners so that a behavior change really happens. Okay, so some examples: communicating absolute and relative risk. I hope all of you are aware of these two terms. Absolute and relative risk comes from which study design? Yeah, उसको पूछो. हाँ जी. You please. Yep. नहीं तुम नहीं. Yeah. बोलो. Which study design gives us absolute and relative risk? टाइम नहीं है ज़्यादा, जल्दी करो. No idea? Not good. मज़ा नहीं आया. बैठो. Anyone? Louder please. No, sorry. Not case control. One more try you can have. Now it's very easy. Cohort, right? So from a cohort study, usually the risk estimates are best obtained by trials or cohort study. Clinical trials or cohort study, which gives us better risk estimates, tells us more about risk factors. A clinical trial or a cohort study. हाँ जी, without apron. बताओ. It's very infrequent for me to have a class with you, so don't remember names. हाँ जी. Between clinical trial and a cohort study, which study will tell us better about a certain risk factor? तुमको सवाल समझ में आया या बिल्कुल टेक्निकल जार्गन है तुम्हारे लिए? आया समझ में? बताओ. गेस ही कर लो भाई. नेगेटिव मार्किंग नहीं है. क्लिनिकल ट्रायल. आई एक्सपेक्टेड दैट. सिट डाउन. एब्सोल्युटली रॉन्ग आंसर। यही पूछ रहा था कि क्लिनिकल ट्रायल रिस्क ढूंढने के लिए कर सकते हैं, 50 तक कर सकते थे, अभी करेंगे तो जेल जाएंगे, है ना। सिगरेट पी लो, मैं देखता हूँ कि उसे कैंसर होता है कि नहीं, करना है, नहीं कर सकते ना। सो वी हैव टू डू अ कोहोर्ट स्टडी, राइट। सो वी गेट दिस फ्रॉम कोहोर्ट स्टडी, ट्राई टू आंसर दिस। This is a poster, get yourself tested, and what exactly are they reporting here? Can someone try? Especially people who are sleepy. गले में दर्द में सोना मना है। Quickly try. प्री पीजी के क्वेश्चंस हैं ये, हम ही लोग सेट करते हैं, मालूम है ना। ट्राई करो, गेस करो। हर बार वही जवाब दे रहा है, बाकी लोग भी दो भाई, वो तो मोस्टली सही जवाब दे रहा है। हाँ जी, फ्रॉम देयर। एक तो ये समझ में नहीं आया 3 बेंच छोड़ के पीछे क्यों बैठे हैं सब। यू शुड डू फ्रॉम द नेक्स्ट टाइम, डोंट अलाउ देम टू सिट ऑन द लास्ट बेंचेस। बताइए आप, या थर्ड गर्ल आप। Yes, ma'am. Quickly try and answer. नींद भगानी है ना, ये तरीके नींद भगाने के। Please stand up and answer. नहीं आता, बैठो। So you have some certain numbers. We talked about numbers, right? Previous slide. So what are the numbers? One is 1 and 2. Then 25, then 19, then 15, 24, 100, then 1, 6, 50, 3. So many numbers are there. 1. We have to understand which numbers are important. Right? Health literacy mein there are 3 main things which they measure. One is comprehension, one is numeracy. First is comprehension, second is numeracy, and third is understanding. So numeracy means numbers, how much people understand number. You might be surprised to know people are really very poor with numbers, really very poor. And we doctors often tell in terms of percentages. So majority of the Americans do not understand percentages. We do not have a similar study from India. We had a very small study. I did one study a few years back in Bhopal. So the health literacy rate, appropriate health literacy came out to be, guess how much it might have come out to be. What proportion of the Bhopalis might have had appropriate health literacy? Guess karo. It was 1. We did it for medical students also. Till 3 years back, COVID ke theek pehle tak. Every year I used to do it. I did not publish that paper. Guess for medical students? It was about 70%. And that question, those tools were supposed to be answered by anybody who has passed class 6. ठीक है, तो इतना भी सिंपल नहीं जैसा आपको लगता है. So there are certain numbers, and so we have mostly absolute risk here. ठीक है, relative risk also and absolute. So 1 in 2 is relative risk. 1/2 is 1 in 2. समझ में आया? So this will come in framing also. Similarly, we can have this kind of graphics which people are being told about. You can answer similar questions. PPT यहाँ पे try करना आंसर. So now come to the last part, framing. So framing is a process of implicit referencing. The numbers जो भी हमने बात की है कैसे use करना है उसको. So when we have to communicate a certain risk, we have to frame the risk. Frame a sentence, 2 sentence. We often talk, PGs and us, we often talk. ऐसा क्या 3 sentence बोलो that the person who has decided from home आज सोच के आई है कि नहीं आज जो डॉक्टर बोलेगा कुछ नहीं करूँगी या दवाई खाने बोलेगा नहीं खाऊंगी, बट वो 3 सेंटेंस सुन के वो बोले कि नहीं अब तो पक्का खाऊंगी और 10 लोगों को बताऊंगी मैं तुम भी खाओ. दैट इज द चैलेंज. दैट इज एन इंटरवेंशन सिमिलर टू द इंटरवेंशंस ऑफ ड्रग्स और डिवाइसेस और प्रोसीजर्स. सो इन कम्युनिकेशन दोज आर द इंटरवेंशंस. सो वो दिस फ्रेमिंग हेल्प्स इन डिजाइनिंग दोज इंटरवेंशन, दोज 1, 2 और 3 सेंटेंसेस. जो पीछे देखा ना आपने ये फ्रेमिंग है. देयर आर फ्रेमिंग एग्जांपल्स ऑफ फ्रेमिंग देयर. So framing means how you want to do it. So this can be 2 ways. Either you say 70% will survive or 30% will die. So this is called as positive framing. This is negative framing. There are other examples of framing, right? So framing कैसे होता है in communication or public health practice? So it compares different options to the person, to the patient, to the people, and in public health it's often binary, complementary and binary, one or one minus जो भी है ऐसा रहता है. So हमारे लिए क्या important है? It may either prejudice. You understand propaganda? So it's not propaganda. Propaganda एक different होता है. जैसे दो बूंद, right? This is propaganda. तुम्हारा इतना ब्रेन वॉशिंग हुआ है कि मैंने जैसे बोला दो बूंद, तुम्हारे मुंह से निकला जिंदगी की. This should also be done to make people aware that there is something which is important. Once people are aware that something is important, then you tell them, वो बताया था ना, फिर numbers बताना शुरू करो. This framing comes into picture there. ठीक है? So it can also do this. ठीक? So what are the examples? So positive framing, this is the example we just talked about it. Negative framing, positive versus negative, and how does it impact the behavior? So it has been found by research, and it will be different for different types of diseases and messages. So, but on an average, by and large, positive framed messages are accepted more commonly. तभी तो बोलते हैं ना कि थोड़ा प्यार से समझाओ, पॉजिटिवली बात करो तो मानते हैं, बट नॉट फॉर ऑल डिजीजेस, स्पेशली फॉर दोज बिहेवियर्स हु हैव टू बी डन ऑन अ वेरी शॉर्ट टर्म और इम्पल्सिव बेसिस. जैसे स्क्रीनिंग कराना है, किसी को पुश करना है, सो दोज शुड बी नेगेटिवली फ्रेम्ड. नहीं कराओगे तो ये हो जाएगा, या ऑपरेशन कराएंगे वो नेगेटिव होता है. वंस द डिसीजन हैज बीन मेड, इट शुड बी फॉलो अप बाय पॉजिटिव फ्रेमिंग. स्पेशली डिसीजन हो गया, आपने इंटरवेंशन भी कर दिया, देन पॉजिटिव फ्रेमिंग. बिकॉज शुरू में दोनों मिक्स कर दोगे, देन देयर वुड बी अ इनडिसिसिवनेस. इनडिसिसिवनेस शुड नॉट बी देयर, एंड वट एवर वे ऑफ फ्रेमिंग वी हैव डिसाइडेड, यू डू इट फॉर सर्टेन पॉइंट टिल दैट बिहेवियर हैज हैपेंड. तब तक नया मेथड नहीं अप्लाई करना चाहिए, राइट? सो सी, सो अर्जेंट एंड लाइफ थ्रेटनिंग थिंग्स पे नेगेटिव करते हैं, बट मोस्ट ऑफ द बिहेवियर चेंजेस और हेल्थ प्रमोशन वी यूज पॉजिटिव फ्रेमिंग. अनदर एग्जाम्पल कैन बी एब्सोल्यूट रिस्क वर्सेस रिलेटिव रिस्क फ्रेमिंग. So absolute risk means simply likelihood whether something will happen or not. So 1% chance of developing clot. This has to be told sometimes. Or relative risk also. Doubles your risk of developing. There is, you remember social comparison? ये social comparison type का है. Of all people who are similar to you, if we have 100 people like you, 30 of them will develop this thing. So you think you might be one of those 30 if you continue this behavior. That kind of framing is relative risk, and 30% will develop it. So that is a absolute risk framing. Gain versus loss framing. So how much you will gain? See, you can increase your life by 10 years, or how much you lose. For different types of people, this different versions may be used. Or single event probability versus population level framing. Often we get population level evidence or data, and that has to be interpreted for an individual, right? The risk of developing cardiovascular disease among hypertensives in India is 10%. So this is a population level evidence, and the framing is so what kind of framing you want to do. So out of a population of 1,000, 100 people will develop. Here it is one for that 10% example, it will be 100%. Or you have 1 in 1,000 chance of being affected. So this is me as an individual. So depending on what kind of personality a person is, we can frame it likewise. Social comparison ज़्यादा उसके मन में है, या individual वाला ज़्यादा है. And then temporal framing, time sequence related. Time sequence, say for example, if you do not wear sunscreen, you will increase the risk of sunburn today. तो आज के लिए बोलना है तो आज की बात, आज वाला रिस्क बता दो. Or if you continue doing it for say 10 years, 20 years, then your risk of skin cancer will increase by. Or you can simply have no numbers here, simply it will increase, right? So temporal framing can also happen. Some examples related to this. So risk communication shapes risk perception, of course. So you remember the risk perception, I told you in the earlier part that risk perception may not be the actual risk which people may have. ठीक है? So that can be changed by doing good risk communication, and it can be done at both individual and public health levels. ठीक है? So this is an example. Study on smoking cessation found that risk communication emphasizing immediate health benefits led to higher rates of quitting. तो benefit बताओ तो ज़्यादा फायदा होता है in some scenarios. In other scenarios, it may be something else. So we have to How do we know this? We know this by doing research, and it should be different for different populations even inside a country. There are so many complex factors playing here. Okay. So there maybe we have talked about this, and so in conclusion, when we have to communicate risk, we have to be very clear about the objective. क्या हम चाहते हैं? So say for example, we saw that the inappropriate risk perception level is 90% in a certain population. And suppose smokers, contraceptive users, hypertensives who are not indulging into physical activity. You can have any group you can call population. Each of the group should be considered as a different populations. So for them, our objective should be very clear, and the objective should be objective. Objective means it should have a number. So by 1 year, how much effect do you think will happen? 90% का risk perception अच्छा नहीं था, गलत था. So you may decide that okay, by end of 1 year, after the intervention has been launched, this should decrease by 30%. किसी छोटे से ग्रुप में हुआ था, and now this is being launched for an entire city. पूरे शहर में launch हुआ है. There have been examples of like this. वो ऐसा हुआ है examples. So that clear objectivity should be there. Segment audience, we just talked about it. You can have a different types of audience depending on which audience are favored or get influenced by what type of framing. उस type का messages अलग अलग होगा, right? And then we have to test. We can test those by clinical trials. So there are a lot of clinical trials. अगर तुम तो खैर STS तुम्हारे लिए eligible नहीं है, but as a student also, if you want to do a research or read about research, you should convince your colleagues or seniors to do a research on this. Intramural कर सकते हैं, ऐसे कर सकते हैं. Okay, so we have developed a very simple diagram or schematics or a poster. I believe that by using this poster, a particular behavior can be improved or decreased by a certain percentage. Test it. 3 महीना करके देखो, 2 महीना करके देखो. It's a very low hanging fruit. ठीक है. Then other things, so language and all. Numerical risk जब use करना होता है, so we use absolute risk usually, single unique event वाला. Appropriately we sometimes we may use proportion or frequency, and if we have to decrease the bias, we often use with or without outcome for percentages or frequencies. ठीक है, so that people can compare. People who are not having this behavior, they have this particular risk. People who have this behavior, this is the risk, so they can compare. So that kind of information is talking about. ठीक है, visualizations means how they are shown to people. So videos or graphs or posters or pamphlets or simple numbers, what kind of visualization should be used, that is a separate topic. This also has to be. So one example is this. So there are 3 different types of visualizations of the same thing. So for you, it might be different. तुम सबको, majority of you might be more influenced by one of these 3, but different types of people will get influenced by different types of visualizations. सब तीनों एक ही बात है. What is it? 4 in 100 women develop breast cancer during their lifetime in India. तीनों वही है, but the way it has been shown is different. ठीक है, and they often test it by a trial करते हैं. One more example of breast cancer risk factors. कौन कौन से हो सकते हैं? It can be either this or this or this or this. All of them are same thing, right? So I hope it was useful. Next classes Dr. Pankaj will take attendance.